I'm Dr. Tanya Nino, and I am a dermatologist and Mohs surgeon with St. Joseph Hospital. More than 3.5 million skin cancers are diagnosed in the U.S. annually, and 1 in 5 Americans will develop skin cancer at some point in their lifetime. Melanoma incidence rates have been on the rise over the last 30 years. According to the National Cancer Institute, California will have the greatest number of newly diagnosed melanoma cases. Of all counties in California, Orange County has the 3rd highest melanoma count, second to Los Angeles, and tied with San Diego. We all have loved ones and family at risk for melanoma, so it is important to have any suspicious lesions checked by your doctor. The good news is that melanoma is curable if found and treated early. There are common warning signs of melanoma that distinguish it from a normal skin spot. In dermatology, we refer to these as the A, B, C, D, E's of melanoma. A stands for asymmetry. This means that if you draw a line down the middle of the lesion in any direction, one side will not look the same as the other side. B stands for border. An abnormal lesion is more likely to have a jagged or blurred border than a normal lesion, which would have a nice, smooth, round border. C stands for color. We don't want to see color variation in a pigmented spot. So you want a nice uniform color all the way throughout, as opposed to, for example, a spot that has brown and black discoloration or brown and pink, brown and red. That would be more likely to be an abnormal spot. G stands for diameter. That means that any mole of large size or sudden continuous growth needs to be evaluated. E stands for evolution, which means any change in the lesion over time. It is easier to find a cancer if you are doing self-skin exams. That means standing in front of a full-length mirror with the help of a hand mirror or a family member to check the back of your body as well. Any abnormal spots should be brought to the attention of your doctor. Now, if your doctor determines that a spot on your skin needs a biopsy, there are different biopsies that can be performed. Before doing a biopsy, your doctor will numb up your skin with a small and superficial injection of a local anesthetic. Usually this feels like just a poke and a burn that only lasts a few seconds. One of the most common types of biopsies performed is called a shave biopsy. You may have also heard this called a scraping procedure. In a shave biopsy, a small blade, oftentimes a flexible blade like this called a dermablade, is used to scoop or shave the lesion in question off of your skin. Usually this results in a small open sore that is left to heal on its own. Depending on how thick or suspicious the lesion is, your doctor may need to take a deeper shave or a scoop of the lesion. This may result in a deeper sore that takes a little longer to heal. Either way, the shave biopsy procedure is a quick and easy in-office procedure that takes no more than a few minutes. Another type of biopsy that can be performed is a punch biopsy. A punch biopsy uses a small tool called a trephine. This is a trephine, and it twists into the skin and pulls out a plug of tissue. The area can then be left open to heal on its own, or your doctor may put in a few small stitches to close the wound. Less commonly, an excisional biopsy can be performed, in which the entire portion of the visible lesion is removed for examination. In an excisional biopsy, it is a deeper and more invasive procedure that will require stitches. Your doctor may perform this procedure if the suspicion for melanoma is higher. In any type of biopsy, it is important to remember that there may still be microscopic roots left behind that were not visible to the naked eye. In most cases of melanoma, your doctor will need to go back later and actually do a wider excision, or what we call a safety margin of normal appearing skin around where the lesion was. Now, depending on the thickness and stage of your melanoma, your doctor may recommend a procedure called a sentinel lymph node biopsy, where 1 or more lymph nodes are tested to see if the melanoma has spread microscopically. It is important to remember that ultraviolet light is the single most preventable risk factor for the development of skin cancer. It is important to protect your skin from the sun, do regular self-skin exams, and when in doubt, ask your doctor. If you have any questions or concerns, please contact us at the Center for Cancer Prevention and Treatment at St. Joseph Hospital.